Dermatitis is a very broad term that generally means inflammation of the skin. Acne is the most common temporary skin condition. Eczema or atopic dermatitis is the most prevalent of the permanent skin conditions. Psoriasis is the chronic, lifelong, hereditary skin disease most common in adults. It produces a rash found mostly on knees, elbows, scalp, lower back, armpits and groin. It can also affect the fingernails. Eczema is found most commonly on the flexural areas of the body, the parts of the body able to flex. That is, the backs of the knees and the insides of the armpits, elbows and groin. Many things can trigger psoriasis, including stress, cold weather, skin damage, and certain medications. Eczema appears at a younger age, infancy or childhood, and may be transient through life. The condition can flare up from sunburns or cleaning products or certain soaps and environmental factors. The psoriasis rash is more painful and inflamed than eczema. It remains dry and does not usually blister or ooze from sores. Linked to reduced immune function, clearly demarked red or pink patches appear on light skin, darker patches appear on darker skin tones. It itches, stings, and burns. Scratching an eczema rash releases serotonin, which exacerbates the condition into a cycle of itch and scratch. A rash forms and the skin becomes irritated. The red to brown inflammation and dry, rough, cracked skin can cause blisters and papules, which can scab and ooze. Intense itching causes bleeding. There are several types of psoriasis, the most common of which is plaque psoriasis, an autoimmune condition that occurs when a person's immune system triggers skin cells to grow faster than they usually should. Instead of the dead cells coming off the skin, they build up on the skin. Normal skin is made up of tightly packed keratinocytes, which create a healthy barrier. Eczema, also known as atopic dermatitis, causes the skin cells to become inflamed and loosen. The result is a scaly, irritated, and itchy skin. Eczema onset usually begins before age 2. Those who live in developed countries or colder climates seem to be more prone to developing eczema. Anyone can get psoriasis, regardless of age, but psoriasis is most likely to appear first between the ages of 15 and 35 years old. Males and females get it at about the same rate. According to the International Federation of Psoriasis Associations, IFPA, about 3% of the world's population has some sort of psoriasis. In the United States, there are about 150,000 new cases every year. There is no cure for psoriasis. There are many ways to treat symptoms, best prescribed by a doctor on an individual basis, beginning with topicals to phototherapy or injections. Some natural remedies recognized by the medical field include aloe vera, Oregon grape, also known as barberry, and fish oil. No current cure exists for eczema. Symptoms can be treated with lifestyle changes and skincare, and considered prescriptions from a physician. As well as phototherapy, there are habits that alleviate the condition, such as wearing loose-fitting clothes, moisturizing after bathing, patting the skin instead of rubbing it dry with a towel, using a humidifier in dry or cold weather, using mild soaps, and taking lukewarm baths. For more information, please consult your physician.